So you scanned the internet looking for chicks with pierced nipples, and you slipped a couple clicks and went and found the talking cripple. His concept is to share with you his many thoughts, and it's clear-headed cause he never drank a beer or hit the pot. So if you have an open mind and a willingness to learn, stay tuned to this page and just see what you may learn. Now grab yourself a snack, kick back and enjoy the unique views of life brought to you by Crippy Boy.
Today I'm going to talk to everyone about Community First Choice, a section from the Affordable Care Act dealing specifically with long-term care, and that long-term care being provided at home and in the community. This is also known as Section 1915K of the Social Security Act, and Community First Choice is oftentimes referred to as CFC. These regulations were due out last October 2011, after the proposed rules were published in February 2011. However, there's been some delays, and they just came out on April 26, 2012, after some, let's call it, persuasion by ADAPT in Washington, D.C. on April 24th.
First choice! Release the red no! Community 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 first choice!
So after a few hours of that in Washington, D.C., that was at the Department of Health and Human Services, and some negotiations between Henry Claypool and Cindy Mann from HHS and the leaders of ADAPT, they agreed to release the regs that afternoon. They sent them over to the Federal Register to be printed, and like I say, the draft rules came out on April 26th. The final cleaned up, and when I say cleaned up, it's just a formatting issue. The contents will be the same. Will be out on the Federal Register's later next week or the following week. I'll put the links in the notes below this video so you can download them and view them for yourselves. The current version now is 304 pages, so it'll be some fun reading for everyone. That's why I decided to do a short video just describing what Community First Choice is. This is a state plan option for Medicaid. I say option and I say state plan explicitly because it isn't a waiver program and it isn't required. States can choose or not choose CFC, and CMS has left a lot of leeway for states to work around and make their programs fit within the guidelines. They aren't too stringent, so states can keep existing programs. States could possibly modify their current programs to utilize CFC or to turn them into CFC programs. There is a big incentive to qualify programs as Community First Choice programs, as the feds are kicking in an additional 6% to states. Normally the feds match 50%. On this program they'll match 56%. Now, they're not just doing that because they want to help everybody out. It is part of trying to remove institutional bias and comply with what's known as the Olmstead decision. That's a whole other topic, but basically says that people have to be served in the most integrated setting possible. And the Supreme Court ruled that that is in the home and community whenever possible. So this program is only for people in the home and community. Now, that's another thing that kind of got left on the side. They released the final regulations on CFC, however, they punted the idea of what the definition of home and community is. They put out a proposed rule for what home and community means. However, that will not be final until late 2012 or early 2013. They're accepting public comment for the next 60 days. It says 30. I was told it'll actually be extended to 60. And they're expecting a lot of comment. Why? Because disability rights groups believe one thing, nursing homes and group homes think another. Nursing homes and group homes have a lot of money, have a lot of power, and so we need to get our voice out and be very clear of what we believe home and community is and is not. There's a link below that also leads you to the proposed definition of home and community. I'm really stressing the community portion because many states like Colorado only allow you to get personal care services in your home. And this is 2012. We have a right to go anywhere we want and get the services we need. That's one of the big issues with our buy-in program that is being fixed. Our Medicaid director, Suzanne Brennan, is working hard on getting that fixed and gonna get the proper services in there, but it rolled out without the services that people like myself need. And a lot of others are being held up from being able to go to work because the state does not allow us to get the services we need where we need them. And oftentimes that isn't at home. That might be at work, that might be at school, that might be out at the restaurant, out at a concert, whatever. There's a whole nother topic, and I got really sidetracked, and I apologize. So back to CFC. So CFC is a state plan option. States allowed to submit a state plan amendment to the CMS, Center for Medicaid and Medicare Services. They have to comply with, like I say, a loose set of standards set by CMS. They have to provide ADLs, IADLs, health-related tasks, and this will also allow for transitional costs, another way to help get people out of institutions. This can pay for first month's rent, it can pay for some kitchen supplies, some bathroom supplies, and while CFC technically doesn't cover home modification or technological devices, if they will make you more independent or help in your transition from an institution, they can be considered to be covered under CFC. So it's more incentive for people to get out of institutions. This is huge. One of the things that CMS mentions in the home and community definition is the right to gainful employment. And that is a huge step in the right direction coming from CMS, because I feel they've really dropped the ball on that. That is the next step in disability rights. But this video is about CFC, and I'm going to jump back to that. They are explicit in what cannot be considered home and community, but then they get a little iffy on how these are defined. A nursing facility, an institutional for mental disease, intermediate care facility for the mentally retarded. And originally they said any programs located in a building that provided those or adjacent to those. That's where they're starting to get a little bit easing up on their language and what they're defining as home and community based. So I really recommend that you read the information I'm linking below and watch for an upcoming video on that, because I am going to discuss what is home and community based. But CFC offers a lot of options for states. They can offer home health care through an agency model, through consumer direction, through IHSS. They are being very lenient in what can be covered under this, but it is very explicitly stated that it must be person-centered planning, not medically based planning. Everything has to be person-centered. Everybody's plan will be different, and for some people a home health agency will be required. For others, they'll be able to direct all their own care. Either way, the feds will kick in the additional 6% to states. In order to get started, states have to set up what is called a Development and Implementation Council. They can use existing groups, but they have to meet certain qualifications, including, I believe it's a 60% makeup of people with disabilities, to plan out how their individual state will implement this and work with the state's Medicaid department to get it implemented. I'm really looking forward to doing this in Colorado. We already have strong support. It's taken a little while to get there, but there is strong support, and with the folks from ADAPT who push this through in DC, I'm sure we'll be here in Colorado and visiting the folks down at our Healthcare Policy and Finance Department real soon to follow up on getting CFC started and working on it in our state. I will be updating my videos here real soon with a more detailed breakdown of CFC. For now, I just wanted to put a little blurb out there so people know a little bit about what it is, and hopefully get excited about it and start looking into it for their states. Thanks for watching. Keep tuned, subscribe, all that good stuff. Thanks.